Welcome to the Neuropathy Support Group and Podcast. I'm Chris, and I'm so glad you tuned in. It's my hope with this podcast to help all of us gather information that might help those that need support dealing with this debilitating issue. Hello, and welcome to this podcast. Before we get started, let's get the formalities out of the way with a medical and privacy disclaimer. I am not a doctor or medical professional. The information on this podcast is from personal experiences and is meant for group support. Additionally, the information discussed is not meant to diagnose, treat, or cure any underlying conditions associated with neuropathy. All names here within are private and will not be shared with any outside sources. Please consult your healthcare provider before making any health decisions. If you have medical concerns or an immediate emergency, please contact your doctor or dial 911. Well, today is another Monday. That means another episode 30, which I'm going to be taking a different direction this time around. There's so many forms of neurological issues out there that different people have. And this one really came close to my heart and really touched me when I read the story. As I said before, I belong to many different Facebook pages. Most of them have to do with neuropathy and nerve pain, but this one has to do with neuropathy and what is called, and I hope I'm getting this right, Trigeminal Neuragia? I guess that's it, but for the sakes of that name, I'm going to be calling it TN from this point on, because that name, I don't want to butcher it like I just did right now, but this is something that I was not aware of that takes place. But this individual, like I said, on one of my Facebook pages has this, and that person was so young that I could tell by the pictures that were taken for this person, and it just made me want to tear up to hear that this person has to go through what this neurological issue is. And when you see the picture, she's wearing a sock hat, and she has a heating pad tucked underneath that sock hat to relieve some pain from this nerve. I guess that's radiates from your brain down, I guess, but I'm going to be going over that here in a few seconds in regards to what this is. But also, I got some latest news on my review of a product that I started taking, and I want to let you know how that went. So let's get started here. So like I said, from this point on, I'm going to just be calling it TN. That way we all understand what I'm talking about, so I don't butcher the name anymore. But TN is sometimes described as the most excruciating pain known to humanity. The pain typically involves the lower face and jaw, although sometimes it affects the area around the nose and above the eye. This intense stabbing, electric shock-like pain is caused by irritation of the TN nerve, which sends branches to the forehead, cheek, and lower jaw. It usually is limited to one side of the face. The pain can be triggered by an action as routine as minor as brushing your teeth, eating, or the wind. Oh, wow. Attacks may begin mild and short, but if left untreated, TN can progressively worsen. Although TN cannot always be cured, there are treatments available to alleviate the debilitating pain. Normally, the kind of medications or anti-convulsant medications are the first treatment choice. Surgery can be an effective option for those who become unresponsive to medications or for those who suffer serious side effects from the medications. You know, when I read the biop of this person, she said that she takes everything that you can think of over the counter, Tylenol, the typical ones that everyone takes for pain. But in this person's case, it just wasn't working. And what I found from others, that it wasn't working for them either. So the TN nerve is one set of the cranial nerves in the head. It is the nerve responsible for providing sensation to the face. One TN nerve runs to the right side of the head, while the other runs to the left. Each of these nerves has 3 distinct branches, which is the TN. After the TN nerve leaves the brain and travels into the skull, it divides into 3 smaller branches, controlling sensation throughout the face. So there's 3 nerves. One, the first branch, controls sensation in a person's eye, upper eyelid, and forehead. Vein 2, or nerve 2, the second branch, controls sensation in the lower eyelid, cheek, nostril, upper lip, and upper gum. And finally, the third branch controls sensation in the jaw, lower lip, lower gum, and some of the muscles used for chewing. That was one thing, too, that I read, that anytime somebody started eating, it was just too much pain for them to try to eat anything at all. So it's reported that about 150,000 people are diagnosed with TN every year. And while this disorder can occur at any age, it is most common in people over the age of 50, which there was no way this individual was that old. So the causes of this TN are primary and secondary. The exact cause of TN is still unknown, but the pain associated with it represents an irritation of the nerve. TN is usually due to the contact between a healthy artery or vein and the TN at the base of the brain. This places pressure on the nerve as it enters the brain and causes the nerve to misfire. Some causes of pressure could be a tumor, MS, a cyst, a facial injury, or another medical condition that damages those nerves. So here's the symptoms for most people. Most patients report that their pain begins spontaneously and seemingly out of nowhere. Other patients say their pain follows a car accident, a blow to the face, or dental work. In the case of dental work, it is more likely that the disorder was already developing and then caused the initial symptoms to be triggered. Pain often is the first experience along the upper or lower jaw. So many patients assume they have a dental abscess. Some patients see their dentist and actually have a root canal performed, which inevitably brings no relief. When the pain persists, patients realize the problem is not dental related. So the pain can be described as sharp, intensely sharp, throbbing, sporadic burning or shock-like pain around the eyes, lips, nose, jaw, forehead, and scalp. And the TN can get worse, resulting in more pain spells that last longer. T2, which is the TN2 nerve, pain often is present as a constant burning, aching, and may also have stabbing, less intense than the TN1, which I just spoke of. So I guess TN tends to run in cycles. Patients often suffer long stretches of frequent attacks, followed by weeks, months, or even years of little or no pain. The usual pattern, however, is for the attacks to intensify over time with shorter pain-free periods. Some patients suffer less than 1 day attack, while others experience a dozen or more every hour. The pain typically begins with the sensation of electrical shocks that culminates in an excruciating stabbing pain within less than 20 seconds. The pain often leaves patients with uncontrollable facial twitching. Pain can be focused in one spot or it can spread throughout the face. Typically, it is only on one side of the face. However, in rare occasions and sometimes when associated with MS, patients may feel pain in both sides of their face. Pain areas include the cheeks, jaw, teeth, gums, lips, eyes, and forehead. So the attacks of TN may be triggered by the following: touching the skin lightly, washing, shaving, brushing teeth, blowing the nose, drinking hot or cold beverages, encountering a light breeze, applying makeup, smiling, or even talking. The symptoms are several pain disorders are similar to those of TN. So TN can be very difficult to diagnose because there are no specific diagnostic tests, and symptoms are very similar to other facial pain disorders. Therefore, it is important to seek medical attention when feeling unusual, sharp pain around the eyes, lips, nose, jaw, forehead, and scalp, especially if you have not had any dental or other facial surgery recently. So here's some treatments, which are non-surgical treatments that could help a little bit with the pain. There are several effective ways to alleviate the pain, including a variety of medications. Medications are generally started at low doses and increase gradually based on the patient's response to the drug. So there's 3 medications that might help. Also, there's a whole list of other ones, which I'll let you go ahead and look at those over whenever I post this. So one of them is a anti-convulsant drug. It is the most common medication that doctors use to treat TN. In the early stages of the disease, that product controls pain for most people. When a patient shows no relief from this medication, a physician has cause to doubt whether TN is present. However, the effectiveness of this anti-convulsant drug has possible side effects, which are dizziness, double vision, drowsiness, and nausea. Another product would be a Gabapentin, which is something I want to talk about because I just started that again. I'll talk about that at the end here, but that medication, which is most commonly used to treat epilepsy or migraines, can also treat TN. Side effects of this drug are minor and include dizziness or drowsiness, which goes away on their own. And finally, there's this new medication. It's a newer medication, has been used more recently as the first line of treatment. It is structurally related to certain other medications and may be preferred, but it generally has fewer side effects, which is good. Possible side effects include dizziness and double vision. And then, like I said, there's looks like about 10 or 15 more medications that they talk about also that might help with the pain. There are drawbacks to these medications other than side effects. Some patients may need relatively high doses to alleviate the pain, and the side effects can become more pronounced at higher doses. These drugs may lose their effectiveness over time. Some patients may need a higher dose to reduce the pain, or a second anti-convulsant medication, which can lead to adverse drug reactions. So now we're going to talk about surgery. If medications have proven ineffective in treating TN, several surgical procedures may help control the pain. Surgical treatment is divided into 2 categories. 1, open cranial surgery, or 2, lesion procedures. In general, open surgery is performed for patients found to have pressure on their TN nerve from a nearby blood vessel, which can be diagnosed with imaging of the brain, such as a special MRI. This surgery is thought to take away the underlying problem causing the TN. So the website that I'm finding all this information gives a whole bunch of other information that I'm not going to get into right now. And it even tells you how to prepare for your appointment, your follow-up, and some of the latest research that's been done on this issue of TN. So one last thing that I did want to say in regards to TN, and this is how I found out about this person, or actually saw this person online. And and this is what they were doing. Many people find relief from TN pain by applying heat to the affected area. You can do this locally by pressing a hot water bottle or other hot compresses to the painful spot. Heat a beanbag or warm a wet washcloth in the microwave for this purpose. You can also try taking a shower or a hot bath. So I guess that's one of the things that you can do, and that's why I saw this person with that heating pad on their head, covered with a sock hat. I complain so much about neuropathy, and you really don't take the time to realize that there's so many other issues that can cause extreme pain, like what we deal with on a constant basis every day. So, if I ever come up with things like I just talked about here at TN that I see other people are dealing with, I'm going to talk about it. I feel that, it's just as important as neuropathy is for us, is to get the word out there and to hopefully in some way help them by, the information I'm reading out, or at least it'll get them in the right direction of knowing to talk to their doctors and have them diagnose you the correct way. In most cases, it could be an MRI too. So if you're ever having any type of pain, and that's for neuropathy, or even what this one is here at TN, you need to write down all the issues that you're having. That way you can hand those to the doctor and hopefully get something figured out. Now, I do want to talk about, before closing here, of the Gabapentin that I started taking. Well, it worked for a couple weeks. But then I started noticing this one cramp, this leg cramp I was getting in my left leg. It felt like somebody either kicked me and gave me a Charlie horse, or my nerve had just tightened up so tight that, it's like I pulled the muscle. I couldn't walk that well at all. I was limping around, and the only thing that I could contribute it to was the Gabapentin that I just started taking, because that's the only change I made to my health. So when I stopped it last week, now I'm starting to notice that my leg's coming back to normal, and that is one of the issues or side effects that you could get by using this medication. So now I'm back to the drawing board, because I know Lyrica stopped working after, about 10 years it finally stopped working. I just didn't seem like it was working anymore for me. So that's why I made the change, because everyone talked about Gabapentin so much. So, but obviously it's not going to work. So when I go to talk to my doctor next month, I'm going to have to discuss that and see if I can come up with some other medication. And those hemp gummies that I've been taking, that I put a picture on my Facebook page, those seem to be working. I'm up to 2 of them though, and it seems to work. It's not that effective. It's like anything else. It just depends on your body and how it's going to react. But I'm going to keep taking those. I'm not going to change the regimen on that for myself, and see how many or how long I can go with some relief. I'm probably going to see if I have to bump up to maybe 3, but I'm not going to do that right now because I just changed it to 2. So, but I wanted to leave you those reviews on those 2 products so you can see where I'm coming from on my end. But I hope this episode has helped those out there that do deal with TN. So again, until next Monday, I will talk to you then. Have a good week. Everybody enjoy your time. Read a book. Get out there and walk. Do some things that are opposite of what you usually do. In my case, sitting on my chair. So, but I do read books, and that's one of my joys in life. So I will talk to you again next Monday. As we come to a close, it's my hope this podcast and other sources, such as product reviews that I have discussed today, can better our lives and give us some relief dealing with neuropathy. This episode plus others are posted every Monday on Facebook, Twitter, Instagram, iTunes, Spotify, and Stitcher. And finally, whatever life throws at you, even if it hurts you, just be strong and fight through it. Remember, strong walls shake, but never collapse. Talk to you next Monday.